I have the bell, but go ahead if you want to play that.
Do you hear the sound from my phone? Does that work?
I heard that.
Yeah, that was good.
Awesome. So we'll call the meeting to order. And right now we don't have any guests that have logged in,
Okay.
but we will welcome everybody to my first official meeting as the host. And I'd like to open it up now for any happy dollars that anybody would like to do. And I'll kick it off with 5 happy dollars for an amazing weekend getaway that I just had over on Kona side. And it was just a lot of fun. And so, yeah, so I'm very happy that I got to get out of the rain for a couple days.
Yay. I'm going to give 10 happy dollars because it is Keith's first meeting.
Yeah.
And also to wish him a happy birthday.
Thanks.
And also because Elena's here. And Elena, I didn't know that you and my daughter knew each other.
Yes.
Megan, she says, oh yeah, I played soccer with her and your sister. So kind of cool, yeah.
It's real fun. Yeah, nice.
Yeah, so that was cool. So there's my 10 happy dollars.
Awesome.
Yeah, I want to make 10 happy dollars too because this is Keith's first meeting.
Thanks, man.
We're here. And that's awesome. Yeah, and plus Elena's here too because we don't get to see Elena. I don't think like in person. I've seen you for a year, like in person.
I know. Yeah, and I'll give 10 happy dollars too on my part to congratulate Keith and wish him a happy birthday too. And
thank you.
Just really think that, and also welcoming me and inviting me to Equality Hawaii, which was a really neat experience to get to know my community, my LGBTQ community, and to see what good folks and good mission that you guys are embarking on, and looking forward to being a part of it.
Yes, I hope that you're going to join us as an official board member. I'll see. Awesome. Well, thank you so much. I just need to have birthday every week, apparently, to collect all these happy dollars for the club. So that was awesome. Thank you, guys. So our announcements, I know Ben has a few announcements, but the one that I just want to get out there is April 24th is going to be our Rotary at Work Day. And so that is a District 5000 statewide project that we're working on, which is coastal cleanups. And so our club is going to be doing a cleanup at Camilo Beach down in the Ka'u district. And so we're going to start early that day. We'll meet down in Na'alehu for anybody that wants to join. We do need some people with some four-wheel drive trucks to help us get down there, as well as to pull stuff out of Camilo Beach. But we're going to be partnering with that with Hawaii Wildlife Fund. For anybody that wants to join that wanting to bring their kids or doesn't want to have quite such an adventure to get in, we are also going to be partnering with the Hilo Bay Club, and they're going to be doing beach cleanup along the Red Road between Hawaiian beaches and the Wawa or Va'a neighborhoods to help clean up some areas down there that have become dumping grounds. So those are the two kind of coastal areas that we're going to be working on here on East Hawaii. But each group is able to accommodate up to 20 people now that the governor has, or the mayor has lifted the 10-person restriction for outdoor gatherings. So we are able to get a little bit more people involved. If anybody wants to be a part of that, just send me an email for now, but we're working on getting a sign-up sheet in place. And I know Ben has a few email announcements as well.
Okay, yeah, so just wanted to dovetail off of what Keith was saying about trying to get the work thing going. So next week we're gonna have a meeting. Next Thursday, a meeting for all of the East Hawaii clubs to see if we can sort of collaborate together to make this thing happen on the 24th. There's also now we're doing a lot of Rotary training the next 3 weekends, 27th, April 10th, and April 17th, for new board members, new club presidents, which would include Keith, and then anybody that's participating in the leadership of any Rotary positions in the club. So I think that's it for now. As we go on, I'll think of some more stuff, and then we can go from there. So that's it. That's it for like this minute. Zeta, do you have any announcements?
No. No, I'm good.
Yeah, sorry. Just wanted to make sure.
Just throw that at me at the last minute.
Yeah. Just wanted to make sure we didn't leave you out.
Right. Any announcements that you want to do, Elena, before we officially turn it over to you as our speaker today?
Announcements. Maybe one announcement is that we are looking forward to opening up our East Hawai'i Health Clinic in Ke'au, which is in the old Shipman headquarters, right off the highway, right there, across, adjacent to the Longs, or right, I don't know what you call it, behind or in front of the Longs in Ke'au. So that's our new primary care clinic, and it'll also have some behavioral health services available there. So we renovated that space and added some parking, and we look forward to opening it up in the end of the month or May, and provide access to healthcare out there.
Oh, that'll be so wonderful. Much needed.
Yeah, and jobs. Yeah, jobs out there.
This is gonna. So it's not like an urgent care clinic, right? It's like a.
I think they do have some urgent care capabilities, but they're going to try to function, or they're going to function primarily as primary care, but with urgent care opportunities. Yeah, that's how some of our other clinics also operate too.
So who's the physicians for that? Are they, I mean,
Yeah, I think we're gonna, it's to be determined. I did hear of one of our soon to be graduating residents going there, but of course you'd want that paired with a senior staff member. So we will see who's going to be announced there.
So that would be under Hilo Medical Center.
It's under the East Hawai'i
hospitalist kind of people, kind of like that there.
It's under the East Hawai'i region of HHSC. It's part of our operations. It's our outpatient clinic arm of our operations. So yeah, it does fall under our hospital's leadership.
Okay. Oh. Where's the other ones at? I was curious.
Well, yeah, our first rural health clinic was actually out in Ka'u, which is attached to the Ka'u hospital. It's right in the same building. And then we took over Puna Community Medical Center at the Malama Marketplace in Pahoa.
Okay.
And then we opened up, and then we converted the residency clinic in the hospital to a rural health clinic. So that's why the new name is East Hawai'i Health Clinic at 1190. Then across the street, we have another primary care upstairs from the cancer center that's called East Hawai'i Health Clinic at 1285 by Nui Nui Avenue.
Right.
And also staffed by two graduates of our residency program there.
Because did you have one over by Kapu Elementary School, which was across the street right there?
Yeah, that was the first iteration of our clinic attached to the residency program. And they quickly outgrew that space, and we were paying, a pretty penny for rent there. So that's why we moved it into the hospital.
Yeah.
And under the rural healthcare model, we do get higher reimbursements and have been able to put the majority of our clinics actually under that umbrella to increase the reimbursements from the federal government.
Yeah, nice. Yeah.
So much better model for us to be in the outpatient and specialty care business.
Good,
Awesome.
good to know.
So what kinds of, with all these additional, clinics and, you have your residency program here, what kinds of areas now are we able to address more medically that we didn't have the capability of doing before? Where people they have to go to Honolulu to see a specialist or what?
Well, we had a shortage in vascular surgeons. We didn't have one. Raymond Lee, I think he either closed his practice or just primarily practices in Oahu now. So we had to hire a vascular surgeon who is actually a Matsuura of the family, but he's very busy and has a physician's assistant paired with him. We just welcomed a gastroenterologist within the last 2-3 months. He's extremely busy, so we are hiring for that position, a partner in there, and another one for vascular. So there's that. We have a nice team of cardiologists on board, and it looks like we're about to start the construction of our second cath lab after it came out of permitting. So now we got the green light. That'll be good,
Wow,
that's for lots of folks. Yeah, and then if you drive up here, you'll see the construction across the street to expand our cancer center. That's a big lift right there in a small space, but it'll provide a lot more infusion chairs and more space to provide other specialty care. Upstairs is ENT and urology and the primary care. And I feel like I'm missing one more, but that's pretty much it. But the primary care is quite large. Oh, and OB.
OB.
Oh,
Yeah.
Wow, that's awesome. Lots of big progress.
Yeah.
All sorts of progress. It's hard to keep track, especially when we're in vaccination land. Yeah.
yeah.
No kidding. It's been a year for that. So I know you have some exciting updates to share that just came out yesterday. So why don't we go ahead and turn it over to Elena to talk officially.
Right. So hi, everyone. Thanks for inviting me to come and share with you the hot off the press information that we did open up our signups for 50 and older. These are folks that have been waiting patiently, some impatiently, but patiently to get their name called. This does not mean that we're not doing the other groups. We certainly are doing the other groups. In fact, we've done so many of the 75 pluses and 70s and 65s that we knew that opening up the age band down to 50s was going to be beneficial, so we could fill our mass vaccination pods on April 3rd and April 24th. I do want to just impress upon everyone that our Kupuna clinic down the street at the Arc of Hilo is open for folks who need a little bit more TLC, a place that's has a shorter distance to walk and ample parking. So we are trying to take care of two lanes here in which we can vaccinate a lot of folks who can, quote unquote, maybe slow jog through the mass vaccination clinic and get as many people as we can. We're shooting for 5,000 folks on the 3rd and the 24th. And then our Kupuna clinic on the street does about 300 vaccinations a day for mainly folks who are Kupuna and can't walk too far.
That was you, Ben.
So I think we're
that was Ben.
Yeah. Thank you for that.
He went to that.
yeah.
Hey,
Sorry, Elena. Sorry, I just remembered the Kupuna was Ben.
I mean, and both experiences actually take about the same time to go through. It's about 25-30 minutes max. I think we're quite proud of offering these two different lanes to folks, so we can make sure that, hey, we're trying to take care of as many people as possible on one hand, and then give a little bit more TLC to folks who need more time. shortly after we made our announcement, Kona Community Hospital also has been in agreement that we do need to open it wider because they are doing mass vaccination pods on Thursday at the gym down there in Kona, at the old airport in Kona. So this wasn't just something out of the blue that we were thinking about, that would be like, hey, it's Monday, let's just announce something, we've been really, it's the whole pandemic, the whole vaccination effort, it's been, we had to make a science out of some sort of chaos or loose parameters here. And so we looked at our calendar numbers and we said, we have to open it up. And that's why we did. The Department of Health, of course, never came out and said, we're going to do 50s, yet. But so they, there was a little bit of panic over there. And we just explained to them that we're opening up the signups. It's not that they're, 50 and older is going to get a shot before the 65-year-olds and older, because the 65 and older had a week and a half to schedule their appointments, which is why we still have our earliest appointment at the Kupuna Clinic is on April 17th. So we're talking a good solid 3 weeks out before 50-year-olds can still at the Kupuna Clinic, unless they qualify to go to the mass vaccination clinics. So this is where the gap existed, because we could vaccinate work. People who are required to work and work within 6 feet of their coworkers or staff or customers, they qualify. We are not going to be gatekeepers here. Hey, if you go to work, we think you should be vaccinated, so come get it. We do think that as the age bands go down, we're going to have a little bit harder time convincing them to get their vaccination, unfortunately. So I think those who have been vaccinated, we're going to call on them to help us encourage others to get vaccinated. There is quite a big population that is hesitant, between hesitant and completely against vaccinating. But we do need to make sure our numbers are quite high in order to make sure that community is safe. And but I think that the most success we can get is through personal connection, personal interactions, to encourage our closest or nearest and dearest to get the vaccine. So more information will come out on that, and messaging that, people know the vaccine's out there. It's theirs to have if they want it. I can't tell you how read up I am on the vaccine hesitancy issue. We knew that this was going to be an issue from the get-go. We were dealing with this issues when they started requiring it for HPV vaccinations and flu vaccinations for kids to return to school. And then COVID hit, so they didn't have to go to school. But we'll see what happens when they do again. But that's the short of it. So please encourage folks who you guys know of 50 and above. And then, of course, those folks who may have been a little bit slow to the get up, or, I've heard this a lot from people. We're going to wait till the second round of vaccinations. I'm like, what second round? I think they want more information, and not to make light of their hesitancy, but I think that there's been enough people out there in the world that have been vaccinated for us to have some solid data on its side effects. But we'll see.
Yeah, so when I hear that people are talking about some of their hesitancy and their resistance to getting the vaccine, one of the things that I hear a lot of people say is that there's a better chance of dying from the vaccine than from COVID, which I don't think the data supports. But can you talk about that a little bit and what the data is actually supporting?
Well, the 95 efficacy means that your chances of being hospitalized and suffer from long-term effects is greatly lessened. And if you don't take the vaccine and you get COVID, maybe you won't die, but you might have the lasting effects. And why even bother or chance that possibility is my question back to the person. I'm grateful to the long haulers who share their experiences with having the long-term effects, because people need to know, like, it's, even though you survive, it doesn't mean that it's a walk in the park afterwards, and you could be completely healthy. So that's what I would say to those folks who are like, no, but they keep on repeating it, right? It's not that many people die of it. Well, maybe you have one person or 5 people who is important to you in your life. And if one person of the 5 dies, then that's plenty enough, I think,
So Elena, is there anything, any kind of outreach being done for those kupuna or people who they don't have internet access and they don't have transportation? So how are they dealing with, or are they even going to deal with people like that?
Yeah, so all of the pods on the island, we have a Wednesday call, and we've been making sure that different facets of our community have been taken care of. KTA has done an excellent job in reaching out to senior centers, senior housing, to go to those places where they can just vaccinate the entire housing complex, and then move on to the next housing complex. So they've gone to Ke'au, they've gone to the Moho'uli senior housing place, and other areas. They've done special groups. Those folks who are homebound, home care, care homes, and then foster care homes too. So they've been really helpful in that. Bay Clinic and even our rural health clinic in Ka'u, they're starting to pull resources and do weekend clinics to do about, I think, 100 shots out there. They just did their second clinic this past Saturday. So, for those who can't come into town on the mass vaccination clinics, we really do feel grateful and a whole lot of gratitude to our partners out there who are finding, and we're trying to uncover all the niches that really need some special TLC and attention. Of course, the next question is, well, what about the homeless population? So, there's talks with Hope Services and how we can do that. And the Department of Health is really helping to zero in on those vulnerable populations.
Are you folks, or is anybody going to the homes yet? Like for those who are running care homes at their houses and they can't move their patients in?
Yeah, they did that early on when the long-term care facilities were getting vaccinated. That's when KTA was going into the foster care homes or the adult care homes. Yeah.
And which are the vaccines that are available here on the island? Because I know that there's a couple different vaccines out there, right?
Yeah, so hospitals do the Pfizer because we have the special freezer. Everyone else does Moderna, with the exception of Department of Health has that one special Johnson & Johnson clinic on Tuesdays. And I think they're waiting for a resupply so they can open up that on the VAM's website, so people can start scheduling for that. But it was really popular, and it was nice to see that they filled their slots and vaccinated folks who wanted that one shot, because it is beneficial to folks who have a little bit of phobia with the needles.
Yeah. So what percentage of our island has been vaccinated so far?
I've seen reports of 21%. I think that's what I Osal just recently, maybe yesterday, I think. It's pretty good considering, Europe is barely 10%. But I think we're pretty good here. But
So,
there's a huge mountain for us to climb.
Yeah, what is our, we see the numbers, I see them on the news every day, and it seems like our number of infections isn't really that high either, right?
It's not that high, but there's a slight uptick, and any slight uptick should make everybody, double down on their vigilance and put up our guard just a little bit more, because it's really easy to become lax about this, because it's like it doesn't affect it. There's that feeling of it. Well, it doesn't affect me. We don't have it here, right? So we want folks. Yeah, it still can affect you. You can still get it even though you are fully vaccinated, but it's lessening your chances of severe outcomes. But I like it. I liken it to getting the flu shot, right? You can still get the flu, even though you got the flu shot, but you're lessening your chances.
Yeah, I saw on the news yesterday, they had a story where they were interviewing people in Waikiki. There are visitors that are coming in from other states, and in their states, they don't have a mask mandate. So they're just walking around Waikiki, whatever, without any mask. And of course, the local people are giving them the stink eye. So do you foresee that as our tourist industry on Hawaii Island starts to open up, that we'll be more susceptible to people like that they're coming over here and they don't really feel like they need to wear a mask?
Well, I think, we're susceptible. Anytime anyone comes in from the outside, really. And again, even if they're vaccinated, they can still carry it into our state. And yes, they should be wearing a mask. And I think we all need to figure out a way how to approach people when we see them not wearing their masks, to say it in a kind way. And it's all our responsibility, right? Because they could just feel like, oh, well, that person let me go and they didn't seem bothered by it. So let me just walk down another block in downtown Hilo without my mask and go infect those people. I think it's personal responsibility. It's on all of our shoulders to remind visitors to be considerate of our community.
And so with us reaching that 21% vaccination rate on our island, I'm sure that's giving a lot of people that kind of false hope that, we're getting close to herd immunity. But at what level do we start reaching that herd immunity where life might be starting to get kind of back to normal again?
I think the magic number is upwards of 70%.
Wow.
65 to 70%. Let's say our veterans home is upwards of 84 to 88% vaccinated staff and residents. So, that's a good number right there. And I think similar numbers are at our other long-term care facilities in Honoka and Ka'u. Our hospital here in Hilo is low to mid 70% for our staff, but we have a huge staff here, and we're slowly trying to get those who are still on the fence to come join us on this side.
Wow. Yeah, that's
so Elena, after the mass clinics, do you folks ever have leftover vaccines? Like, what do you guys do with them? Because you have to take them out, right, to prep them for people. And then if some people don't show up, what do you guys do with the extras or the leftovers?
Yeah, so we, as the day goes by, and we keep a close eye on if there are any cancellations. So we slow the production of mixing the syringes. So in terms of leftovers, it would be if there's volunteers there who haven't been vaccinated yet, you know, they've given
Yeah.
their time. Yeah, let's vaccinate them. And then it's any other volunteers there who have family members nearby shopping. Are you nearby? Come, you know, come and get vaccinated. So that seems to have been a good way to appropriately, you know, be responsible for the leftover vaccines. But, you know, even day to day, our vaccines at our any leftover at our Kupuna clinic is very rare because, you know, each vial has about 6 doses, and so we have a way of contacting staff's families if they're around, and we'll just make sure those 1, 2, or 3 doses are taken up and utilized.
So are the doses coming in, or the vaccines coming in good now? You know, I know there was delays here and there, but how are they coming in now?
Yeah, fortunately, the delays did not affect Pfizer. It was Moderna, and we had a steady supply of 1 to 2 trays coming in per week. And last week we started getting 3 trays. So that's how we're able to supply our mass vaccination clinics. And then we're seeing also there's a fair amount of cancellations to our Kupuna clinic because they were able to go to CVS or KTA to get their vaccines. So you know, whatever we have left in storage, we can, you know, shift it over to our mass vaccination clinic.
How many doses is on a tray?
There are, is it 95 vials with times 6? Does that sound right?
Yeah.
That sounds about right. Yeah, something like that.
Wow.
So,
It's about 570.
oh, that's 570? No, that's not right. Or is there 125 doses times 6? Would that be closer? That'll be 925, 975, something of that sort.
So just shy of 1,000 doses per tray.
Yeah, there you go.
Yeah.
That sounds
Yeah,
about
so-
right. Yeah.
Yeah, it's a lot. It's a lot. So good. So how long do you think we're gonna have to keep this pace up? You know, I mean, do you foresee that we're gonna keep it up until you know, as in terms of doing these mass clinics and everything, like we're gonna keep it up until we get 60, 75% of the population, because what the president said is that by May 1, he wants to open it up to everybody. And so is that the plan?
We're trying to achieve that. Our numbers look like we can achieve that because our island is vaccinating about 7,000 to 9,000 folks or doses per week. So we can chip away at that number in the next few weeks here to being able to get through the 50s and then open it up further by May 1. So that's what our estimation is.
So
The
what's
only
the-
variable is people being slow to the get up though. So
Yeah.
that might drag it out a little bit, but you know, no register, no grumble. No, I don't know what you say, but on the flip side of that, you want to reach out to folks who do probably have a hard time with registering. So our helpline is always blowing up, and so, as I'm sure the other helplines are.
Yeah. So, so what's the next level after the 50 plus? Is it 30 plus, 35? Do we know?
That it just opens up to everybody else after that.
Oh,
That's
wow.
what we're anticipating. Yeah.
Right.
Okay. And then are we recommending that children get it?
After that, it'd be 16 and above, and then we'll see what the data shows when they're conducting studies. I believe it's with Moderna on children. But we'll see what happens. Yeah.
Okay.
Elena, do you think that eventually that this vaccination will be a requirement, like you have to have measles, mumps, and all that stuff to get into school? What do you think? I mean, I know.
Yeah, I mean, I love vaccines. I think they do wonderful work. And I think that, I was supportive of kids getting shots and getting their HPV vaccination. So as far as the COVID shot, if it's safe for children, then what's the reason?
Well,
What's stopping?
I feel like it should be, but I know a lot of people don't think that way, but I feel like you have to have vaccinations to get into school regardless for the kids now. So why not just throw that one on too? I don't know. Right.
Yeah. It seems like at least half the schools could be, the upperclassmen could be in school now if they got their vaccination and be.
I make it a prerequisite for sure for the college kids, because they're the ones that are just throwing, caution to the wind all the time. It's not the kids in elementary school and high school. You can control them. It's the college kids.
Yeah.
With the vaccine and all of the variants that are developing, do you know, have they started studying how the vaccines help against the variants that are coming out, or is that still very much kind of in progress research?
I mean, I'm a news junkie, so I've been hearing things about, studies here and there about the variants and about, Pfizer being effective for, I don't remember what variant, maybe it was Brazilian variant. But I think the information is slowly trickling out, and we just need to pay close attention to what it is. It's very interesting technology with the mRNA vaccines, which is like, wow, these scientists, they're totally rocking it, but I would say just pay attention. And I think that's what I've heard on the news too, is that the more we get vaccinated, the tougher fight we put up against these variants that are coming up. But, you all hear pretty much the same thing that I hear too. So,
Okay. Well, do you think that as time goes on, I mean, does anybody really know how long this vaccination is going to last? Like, I mean, like measles, right? You get them one time and you're good for your whole life. Or I get booster shots when you're like 12 or 13, but do we know? I mean, obviously they're testing it. They don't have any longevity information on this because nobody's had it very long, right?
Mm-hmm. Yeah, I don't think they know, and we'll just see what happens.
Okay.
But that's what kind of upends the aimment to get it right. It's like, so we're the experiment, and that's when people get nervous about it.
But I think in all of the people who've gotten vaccinated so far, any ill side effects, they usually happen within the first 15 to 30 minutes, and after that, there's pretty much no side effects. Is that right?
There's mild side effects, a few hours later, possibly, include the chills and, the tenderness in the arm and body aches. I've heard some reports of diarrhea and nausea, but we've given out about 20,000 doses and no one has had to go to the ER yet. So, and that's just us giving it out. That's our count on the doses we've given out.
And
it's pretty safe.
Some of the concerns that I hear are about, that the vaccine, it might sterilize people or it might hurt pregnant women and stuff like that. What's the data showing on that?
Again, what I heard, what I've been hearing too, is that they're starting to see, women who have gotten vaccinated and give birth, or women who are breastfeeding. They're showing that passing on the antibodies from the vaccine to their children. And, it's very similar to the flu shot. So, where they tell moms, you should get the flu shot to protect the baby from getting the flu. And those are the reports that I'm getting. Sterilization, I haven't heard that one.
So
I think
is
that's-
the flu shot mRNA as well based?
I don't think so. I think it's a little bit of, I think it was a little bit of egg, but it's not like, they say if you have allergies to eggs, but I don't think it's that. I think it's pretty clean. Yeah.
So do you think that there are going to be any sort of adjustments to how they administer the vaccine? I know, Zeta and Tom over here are old enough to remember the sugar cube for the polio vaccine. Yeah, I remember that, the sugar cube. So do you think there are going to be other ways of administering the vaccine other than a shot, or is a shot probably going to be the only way? And I'm talking about, these people that are needle phobic or all that.
Or the kids, they'll take a little sugar cube before the shot.
Yeah, on the sugar cube, when we were kids, we all lined up, and I mean, really your whole class in elementary school just lined up, and they gave you a little thing with the sugar cube, and you took it, and that was a polio vaccine. But so I don't know. Yeah,
isn't that incredible? It's just incredible.
It was like candy to us. We all wanted to.
Yeah, it was like, hey, I could have another vaccine.
I'm not sure, we'll see what the experts say and what technology they'll come up with. We'll just see, it's the needle is so small,
Yeah.
we'll just, we'll
The
see.
needle, the needle really is tiny, especially the Moderna.
Yeah.
I got my first shot 2 weeks ago,
Mhm.
Yeah.
and so April 8th I'll get my second shot, and then
Yeah,
hopefully a couple of weeks after that I can consider going to the mainland visiting my grandchildren.
Here we go.
Yeah.
Oh, that's exciting.
That's great.
That's reason enough to go and get it. But how was the shot for you, Tom?
A little bit of tenderness in my arm for maybe 2 or 3 days afterwards, but that was it. Now, I anticipate that the second shot, I may have a little bit more of a reaction.
Mhm.
Because, what I've been reading is that very often the second shot, you have your immune system kicks up a little bit more of a reaction, and that's just an indication that the shot is working.
That's true.
Yeah.
We, so one of the side effects that I did an unofficial poll in our office in administration was that the administrators all got a good night's sleep. So those who are notoriously horrible sleepers actually had good sleep. But I think it's a combination of your combination of the immune system kicking in and also being relieved that, we got our shots. So it's been a year.
Did you have you've had yours, right, Elena? Did you have your second shot?
Yeah, I think I'm about 2 months out of having my second shot. So,
How did you feel after your second shot?
oh yeah, I had the body aches and the chills, and I was sleepy. Yeah, I was real sleepy and lethargic, but I just, it was kind of nice not to care for a little bit. I was like, okay. Yeah.
I get my second one.
I recently had my second shingles vaccine, and I had a similar reaction.
Yeah.
A little bit achy, a little bit feverish, and lethargic. And I just, I had some stuff I had to do that day, and I just kind of, pounded my way through them and, came home and took a nap.
See?
And by,
Yeah.
actually by about, that was the day after the shot, but by about 10 o'clock that evening, all those symptoms cleared up. So,
Mhm.
Good.
There you go.
Yeah.
So,
Elena, have
you know,
you
I
heard
know,
if there's gonna be Elena, have you heard if there's gonna be an app that shows who has been vaccinated or not so that people can get back out and start traveling?
Really an app. Hang on.
you have your card.
Yeah.
yeah, I have not heard of an app for that, but I've heard of, an app for, if anyone's near you who's tested positive, that's, I think
Yeah,
that,
right.
I think that was an offering on our
Yep.
iPhones a couple of weeks ago.
Oh, wow.
Wow. So are they going to do this? Do you think the governor's going to do this passport program where you carry around a card that says that you're clear and that you won't have to like now I travel once in a while between.
There it is.
Yeah, there we go. That vaccination card.
There it is. You get a card.
So
Yeah.
maybe
You
that-
know,
you got to carry that so that you can.
that card is,
That's
that
cool.
card is for peace of mind, I think, for folks, but for those who are who have less of a fair mind out there might want to cheat the system or make a buck off of it. But so it's going to have to boil down to big data and big databases, shared databases in which someone can pull your information that you have received, that or government issue cards that cannot be duplicated at office max.
Well, maybe like some kind of an indication on your driver's license or something eventually.
Yeah.
Mhm.
So when I got my second vaccine, they gave me this little red tag, and I think I saw it on your lanyard. Can you talk a little bit about that
yes.
and what the purpose behind that is? Yeah.
It's a red tab that says COVID safe,
Oh,
and we
okay.
give it out to folks who got their second shot. Funny thing happened when we were ordering it. We ordered 25,000 instead of 2,500, and that's why we're gonna give it out. We give it out to folks who want to wear it, and as a badge of honor, or of encouragement to tell people, hey, I got it, or I'm safe, or like you were saying, Keith, when folks come into your facilities, they feel at ease knowing that the staff are safe.
Mhm.
Yeah, for our hospice team, I know a lot of our nurses, they wear it on their lanyards or their name badges, just like you are. And when they go into people's homes, it just puts them at such a sense of ease to know that the person that's coming in to take care of them has been fully vaccinated and that they're not going to bring that into their home. So it's a really wonderful thing that you guys are able to provide the community. And then, like you said, if the more of us that are out there wearing it in the community, it just kind of, it's that, somebody who has it and they're still alive. So let's go ahead and get that vaccine. It's that kind of social proof. Yeah.
That's right. We did see a couple employers when we were reaching out to employers. They said, we said, oh, we'd like to offer your staff the vaccine, and they said, oh, we're not interested. And it's like, well, are you as the owner not interested, or are you not interested in offering it to your staff? So that was a little bit troublesome and worrisome, and that's why people are able to pre-register on our website individually. So in case they didn't get the memo from their bosses, who are the gatekeepers, who had been gatekeepers, then they could take it upon themselves to go get their own vaccination.
Mhm.
Yeah.
Mm.
Well, we're coming
Right.
up on the end of our hour, but so I want to ask any last questions before we wrap up?
Wow, Elena, thank you for to give us everything you ever wanted to know about COVID session. So that's good, because a lot of these questions we asked, Zane and I were sitting in our living room every night and we're asking them, well, like, what about this, and what about the kids, and what about else, and of course we don't know the answers. It's good to have you as a resource, because you do know the answer on that.
Yeah,
That's-
I mean, I
that's
had
great.
I had a sister come in from Ohio, and I'm like, okay, I haven't heard that baby. She has a 1-year-old, and I'm like, I haven't heard that babies actually transmit the disease. But I was fully vaccinated, and like, and then they had negative tests too. So they was like, I might not hug my sister, but I might hug the baby. I don't know, but I'll keep the baby faced out, and I'll hug the baby from behind and kiss the back of his
Yeah.
head. I don't know, but it was yeah. So Thursday is when my daughter can actually go and hug her cousin. So that we'll look forward to that. That'll be 7 days out of them coming home. So
Yeah.
yeah.
So,
But
yeah, so if anything, so this big pandemic that came up, right? And what they're saying now is that, this isn't the last one. I mean, there's going to be more coming down the line, and hopefully not anytime soon. But now, are we at a whole different level of readiness now, you think, when the next one shows up? And I'm thinking there's probably going to be another one, right?
well, we have no choice but to be ready, as the hospital. So we heard that. I was telling folks, hey, did you hear that Lucy's is closing down? I think we should go take that over too. Because it'll be a good fundraiser for the hospital. But
Yeah.
I think that's a funny way of saying how much confidence I have in the team that I'm on, and my teammates. I'm just so proud of when I look around the room and I'm seeing the folks who are making the decisions and saying, and having the confidence and expertise to say, yeah, we can do it. Let's just do it. Let's make it happen. And I mean, literally we're high-fiving and just, we're in it together. And I know that there's such great planners and logistics folks that if you do have the opportunity to drop by our mass vaccination pod, I'd be happy to show you Benson or Keith to come
Cool.
and walk you through to see the operations, because it's quite magical, actually. It's a steady flow of people throughout the day, and it's a great experience for both people on the different sides of the vaccination. Those who are giving it, they're volunteering their time. Those who are receiving it, they show up anxious and hopeful and all a whole ball of energy and nervousness. But when they leave, I've had ladies just cry and tell me, how relieved they were, or see Facebook posts saying, I just got my vaccination, I'm in my car crying, because they're so relieved. It's been real stressful. It's been, I'm sure it took a couple years off of our longevity here, but we'll be fine. Yeah.
Well, let us know, if you need to have a volunteer, Yeah.
What was that, Lonnie?
I was asking Elena, how many people does it take for you to run the mass clinic?
We have about 200 volunteers, and a lot of it, majority of it is our staff. You'll see, you've seen our posts that it's the sea of orange t-shirts. And, I got a lot of flack at first choosing orange I was like, but we're going to be able to see you all. And we're going to be like, yes, look at all the help that it takes to run this thing. But there's a huge sense of pride to be able for folks being a part of it. And there's some families that, Chad Shibuya, his wife volunteers and his 2 kids volunteer.
Yeah.
It's just something real beautiful, and something good to instill in our kids, of course. But it's really nice to see so many of our staff bringing their families and their children to come help and be a contributor to our society and our community.
Well, like I was saying, let us know if Rotary can help with that, because we can, mobilize at least 5 clubs on the east side. Because there's a bunch of Rotarians that volunteer to man the call center for the DOH, but we could come down there too. I mean, we put it out there and people can sign up and help, if you need that help. Sure.
If we want to make sure that our volunteers are also vaccinated too. So that would probably be a prerequisite of sorts. But, you know, we've had some partners in healthcare come, like Hui Malama has really been helpful with us. And then the nursing schools and the pharmacy schools folks, they just really put in their time, but they've been early vaccinated folks too, right? So it's easy for us to draw from that. But we wonder what will happen in May when school, you know, when their finals are over, and it'll be hard to draw from them. So Kiwanis Club has been helping us. And then, yeah, I think it's really nice to be able to draw from folks, especially those who, you know, we've vaccinated, like YWCA preschool, and now like, hey, can we turn around and Kokua as well? So, you know, thanks for that offer, and we'll certainly keep it in mind and see what happens in the near future when we hold 2 mass vaccination clinics in April.
Okay.
Yeah.
Elena,
Really appreciate it.
yeah. I noticed when I went through the Department of Health Moderna drive-through,
Mhm.
they had a lot of National Guard folks there.
Mhm.
Does HMC also get National Guard help for?
Oh,
the
yes,
stuff
they
you-
help us with parking and with the traffic flow. And then also their medics came to help us vaccinate at the last clinic. So
Uh-huh.
it's really a huge help for them
Yeah,
to be there
yeah.
and also maintain calm.
Uh-huh.
Part of me was like anticipating some anti-vaxxers to show up, or, you know,
Oh,
people to
gee.
just roll up on there and demand their vaccine the same day. But we have not had a, knock on wood, security issue or any
Yeah,
issue whatsoever. Yeah. Mhm.
Yeah, but the guard folks were, I saw them doing everything there, you know, directing traffic, reviewing paperwork, and actually the person who gave me the shot, the gal that gave me the shot was in a guard uniform.
Yeah,
So
they're
I mean,
very versatile.
you know, it was great. It was everything was running so smoothly.
You know, I think it's a great opportunity for our community, you know, those who do not know what the Guard actually does, to see them in action. So, you know, it's just been a lot of help. They've been tremendously helpful to us. And Arthur Sampao, our chief nurse, you know, used to help run the Guard. So we've got a lot of support there.
Yeah, great. Well, that's really good.
Well, this was
Yeah,
awesome.
it's really
Elena.
nice to see. It's nice to see the community coming together and you know, to run these clinics, because you know, I saw a lot of folks there who were clearly just volunteers.
Oh, yeah.
Yeah, it was.
Yeah.
It's really good to see the community in action this way.
Yeah, thank you for being such a wonderful steward of our community, Elena, and for coming out and talking to our group about this, and really making a difference for everybody here on our island. You're just doing a great job, and thanks for being a part of our club. We're happy to have you here. So
Happy to see you guys. Yeah.
Yeah, and I'd
Thanks.
like to close it out with the 4-way test.
Yay.
So we will start it off with, first, is it the truth?
This is the truth.
Truth.
Second, is it fair to all concerned?
Fair to all concerned.
Third, will it build goodwill and better friendship?
Better friendships.
Fourth, will it be beneficial to all concerned?
Beneficial to all concerned.
And Elena, you met all 4 of those today, plus the 5th one, which is have fun. So thank you.
Done.
Have fun. There we go. Always.
Thank you, Elena.
Okay. See you guys. Bye.
Awesome.
Bye.
Okay.